please give Department of Health and Human Services Secretary Kathleen Sebelius a warm Head Start welcome, and join me in committing to them that Head Start community is at the table and ready to work. We look forward to working with the administration and Congress in the months and years to come to build a mixed delivery system that not only upholds but also strengthens our effective birth to 5 model for vulnerable children and families. We're committed to the children we serve, we're committed to their families, and we're committed to the communities in which we work. And we're committed to Head Start too.
Well, good morning, everybody. How are you? It's really my great pleasure to be with you all today, and I want to start by thanking Yasmina for not only her kind introduction, but more importantly for her leadership of the Head Start Association. Why don't you give Yasmina a nice round of applause? And I also want to thank all of you. You've come here from around the country. You're here to share ideas and best practices with one another to establish new networks. But each and every day, you are changing your communities and this country a child at a time. So thank you all very much, and give yourselves a nice round of applause, please. You know, I'm going to have a chance to formally introduce him in a few minutes, but I want to acknowledge my great partner and good friend, who it's such a pleasure to work with on early education, Secretary Arne Duncan. He is a tremendous advocate for children in this country, and we are now together so often that I think that my husband thinks he's my work husband on a regular basis. But this partnership is very closely aligned, and we are thrilled to be working together on this very exciting second-term initiative. I want to also just recognize that we have a great team at HHS. Linda Smith, our early childhood guru, Yvette Sanchez-Fuentes, who leads the early Head Start and Head Start programs, and many others are tremendous leaders that all of you have gotten to know over the years. Now, early education is something that I have worked on for a long time. I go back to my early days. I'm a recovering state legislator, and when I entered the Kansas legislature in the mid-'80s, my children were 2 and 5. So I was living a life of early education. That was first and foremost in my mind. And back in those days, there wasn't a lot of conversation about this area, but we began to work on it in Kansas. And then as governor, I continued that priority. And as you heard from Yasmina, we've done a lot in the state level to bring together all of the representatives of programs that deal with children birth to 5 and try to make a coordinated strategy so wherever a parent chose to place a child, they were in a high-quality, important program. But what I didn't have when I was in Kansas was a partner at the federal level. There really wasn't much interest in Washington around a lot of the programs that we were dealing with, and there wasn't a high priority placed on a number of these critical programs. The first year I was governor, we did a kindergarten assessment for the first time ever in our state, a statewide assessment of 5-year-olds, and found that even in a relatively small, relatively homogeneous state like Kansas, 50% of the 5-year-olds who hit kindergarten were not ready for kindergarten, either socially, emotionally, or educationally. They weren't ready to be in school. And that's a recipe, as you all know well, for disaster. So it was one of our big tools to use to convince the legislature and the business community of this critical priority. And unfortunately, that snapshot is still the same today. You know that we've taken actions in the first term, from Head Start investments in the Recovery Act to Race to the Top, Early Learning Challenge, to working with all of you to improve quality in the Head Start program. You've also seen, I think, our efforts to boost child care quality and empower parents through the Affordable Care Act's evidence-based home visiting program. But what you saw was a marked commitment in the President's State of the Union address when he made it clear that in this second term we are going to push a very ambitious initiative, and it's going to make clear that early education is a necessary component of any plan to grow the economy and to make sure we have a thriving middle class. You see our commitment in the close partnership with the Department of Education. I don't know if in history the Departments of Health and Human Services and the Department of Education have worked this closely together since education became a separate department, but I can tell you that this partnership is very much underway. The commitment and collaboration is never as important as it's needed today. So one of the events that Arnie Duncan and I attended this last week was the release of the National Institute for Early Education Research annual report on the state of preschool in America. And I have to tell you, the news is pretty sobering and the news is not good. That's why it reminded me of our kindergarten readiness report in Kansas. In 2012, here's what we see across the country. State funding for pre-K saw the largest drop ever. For the first time, we saw no increase in the percentage of children served in state pre-K. And at the same time, we also know we're only serving 4% of early Head Start eligible children and 17% of the population who can benefit from the Child Care Development Fund. That's a pretty miserable investment. And that's why the agenda the President outlined in his State of the Union for establishing a continuum of high-quality early learning beginning at birth and continuing to age 5 is so vitally important. I want to stress that every part of this proposal builds on the incredible work you already are doing in Head Start. Head Start has always been and will continue to be a leader in early childhood education and a model for the kind of comprehensive program we know works best. With this at its foundation, the President's proposal starts by extending and expanding home visiting programs with support parents in their important role as the child's first and most important educator. Next, it makes important investments in new early Head Start child care partnerships, combined with maintained Recovery Act investments, will triple the number of children who benefit from early Head Start from the start of this administration. 3 times as many kids, and that's a big step in the right direction. We know this. We know if we don't intervene by age 3, children are already falling behind, and some of them are so far behind that they will never catch up. And critically, these programs put a priority on family engagement, which, as you know, is just as important as anything else that the program does for a child. And finally, the President's plan will ensure access to high-quality preschool for every child in America, an investment that also frees up Head Start to serve more younger children, especially the lowest income and most vulnerable. Now, to pay for this, the President doesn't propose that we just add to the deficit. He wants a fully paid program, and his proposal is to raise the tobacco tax. And I want to tell you just a little bit about what that does, because not only does that pay for this important initiative, but it also can pay for a lifetime of health improvements for young people. Every day in America, every day, 3,600 children under the age of 18 will have their first cigarette. 3,000 children under the age of 18 smoke their first cigar every day. 1,000 under the age of 18, 1,000 of these kids become lifetime smokers. And we know that in addition to just a lifetime of health problems and difficulties, 1 out of every 3 of those 1,000 dies prematurely in this country. That's a recipe for disaster, and what we know is raising the cigarette tax affects young smokers because many of them, too many of them, smoke to be cool. And what they do is when the price goes up, they find coolness someplace else, thank God. So it saves lives, it will save healthcare costs, it will raise an enormously important pot of money to put into early education. So raising the tobacco tax isn't just a way to raise money, it is the biggest single step we can take to discourage kids from developing a deadly addiction. We know that a tax increase proposed by the President would keep more than 230,000 young people a year from taking up smoking. That's a really good deal. So to sum it up, the President's early education proposal improves opportunities for millions of children, makes our workforce more globally competitive, and reduces the use of social services. It would save lives that would be lost to tobacco addiction and improve public health. And it does all of this without adding a dime to the deficit. Now that's a program worth supporting and worth pushing across this country. But here's what we have to remember. This isn't a partisan issue. There is strong bipartisan support. There's huge support from the business community. There's huge support from our military leaders. We can't afford not to invest in early education. And I can tell you that this President and this administration will continue to work with you to support the work you do, to lift it up, to promote it, to support all the efforts that you are making to ensure that our youngest children get all of this support they need to live healthy and prosperous lives.